Hello, I'm Dr. Fiona Durban, Clinical Lead of Cosmetic Courses. Welcome to our webinar on getting started in aesthetics. I have today one of our trainers with me called Melanie Collins. She has her own successful clinic in Bedfordshire and is about to open another. So welcome, Mel.
Thank you.
We've got lots of questions people have sent in, and we thought we'd use these as a basis to chat between us and discuss how you might best get started in aesthetics and the best journey for you. So there's lots of questions about level 7. Now, level 7 is a qualification in aesthetics that is currently not mandatory, but we don't, of course, know yet what the regulations are going to be in aesthetics. We're waiting for the government to give us more details on how both practitioners and premises might have to be licensed in the future. But I can ask Mel this question because before she became a trainer, she started the journey of becoming qualified in level 7. So Mel, why did you think getting a level 7 qualification was important?
Well, I think like what you said a second ago is that we're unsure of what regulations are going to come. And what I wanted to do was identify myself as different from somebody else who's also a practitioner within the industry, because I do think it gives reassurance that we've undergone vigorous training, not just attended a one-day workshop. And it just shows that there may be a better depth of knowledge on how to treat somebody, but also how to deal with any complications as well. So what I wanted to do, and the reason why I wanted to do it, was that I guess that it's going to hopefully become mandatory at some point in the future. So I wanted to become a bit ahead of the game, if you like, but I also wanted to make sure that my training was robust enough to be able to deal with any eventualities that came up with me and my patients.
So how did you do the level 7? Because I know there are different routes that we offer. You did one of our faster routes of qualification. So what was that?
So because I'd already been practicing for quite a few years before, I decided to do the RPL, which is the recognition of prior learning. And what that means is that it means I've had at least 3 years of practice, which I had, and then to be able to qualify, we still sit the MCQ. We have to complete some online learning in the same way as the level 7. But what we don't need to do is do the observation days and the foundation, which is like the full level 7. We also are able to have some of our previous work mapped out to be able to comply with the assignment part of the qualification. So I have a master's, and so my thesis for my master's was able to be mapped to be able to provide sort of the assignment part of the RPL qualification. So you do 30 dermal fillers and 30 Botox, which are your case studies that will be submitted, and the MCQ, a practical exam, and then the mapping of my assignments.
Okay, fine. And I did the RPL route as well. So I think that's a common route to have. It's recognised by the JCCP, as is our full level 7 if you were a complete beginner. But we do have the option of a fast track level 7 as well. Now, the fast track level 7 is slightly different because you have to have had 3 years rather than 2 years experience, but you submit 40 cases of each, and you don't have to do the written assignments, you just do the exams. So that's at a lesser cost. It's in the process of getting recognition by the JCCP, but that's proving to be quite a popular route for delegates who have that amount of experience and case studies they can submit. So there are different routes of doing it. Now, if you're new to aesthetics, you'd be looking at doing our full foundation level 7 from our foundation day. So Mel, can you just say what days does that include in terms of coming here?
So you will have a foundation day, so the same as which is the same as a normal foundation day, but then you'll go on to having some observation days as well, where you're observing some of the trainers here delivering clinic procedures, and then you'll have you have 2 observations, 2 practical, and a foundation day, so 5 days in total.
Yeah, and people often say, well, how long does that take? Well, for most people, it takes up to a year. We've got some delegates who have tried to do that much more quickly, so it has to fit in with what else you're doing with work and annual leave to come and do us. See us. Equally, by spreading the days out, you are expected to do work through your online learning, and there is a significant amount of learning to do, wider reading. You might need to be doing your written assignments, so it's quite nice, I think, to spread it out sometimes, and also gain experience at the same time, because one of the exams at the end is a practical exam, which isn't designed to trip you up, is it? But I describe it as a driving test. It's you performing a toxin and a filler treatment. You are being being filmed, but you've very much got to tell us what you're doing as you're doing it and demonstrate that you're checking the lot number, that you're putting sterile gloves on. So it wants to feel natural to you, so that when you're nervous, you're not tripped up making silly mistakes. But the practical exam, most people have no problem with, but there is a written element, isn't there, as well, which is slightly
it's
trickier.
A bit more trickier, but we're really lucky. I think we get an 82% pass rate.
I think 83.
Oh,
Mel.
Sorry.
So I think 83% of people will currently pass the written exam, which is a multiple choice first time. I thought it was actually quite a tricky exam when I did it.
Yeah.
Some of the wording can be difficult, and some questions you might not have heard of, and it's best guess, but a lot of them are based on general aesthetic knowledge, such as anatomy, things you should have come across in the online learning modules or read about. So most people obviously pass it. Occasionally we have people who might have to take that again. Sometimes I think it's because they haven't realised that you do actually have to do some work for it. Would you say that's?
I would agree. And actually I think again it's reassuring for the patients out there that there are things that we should know, like complication management, and that's a lot of the exam questions on how would you deal with X, Y and Z. And actually if you haven't read that, then maybe we shouldn't be practicing on patients anyway.
I would say as well, what I think is nice about the level 7 we offer, the observation days are not just filmed and something you access online. You come here for observation days, so it's very interactive. You're not just sat and watching the trainers deliver treatments. You have a chance to ask questions, the trainer to show you different points of interest, and your practical days are based on a one-to-one. So it's you doing the treatments under guidance, being taught how to do them. We do have to fill out paperwork to reflect on your practice over those days, but it's very structured, and hopefully you show progression over your practical days, because you should hopefully have some way of practicing in between, so that we can see you've improved and you've sort of adding on what you've learned. So I think that is different from how some training providers deliver the course, which I think we do very well actually. So if you're brand new to aesthetics, you want to know exactly what's included on the foundation day, which is going to be your first taste of what it's about. So our foundation day will initially include some prior learning that you have to do online before you come for the day. On the day, we then have essentially a morning of lecture plus a live demonstration where the trainer will do a toxin treatment. You get a chance to look at consultation skills and an assessment of a face and practice marking up for toxin treatments. Then we have lunch, and after lunch you're divided into small groups of no more than 4 people per trainer, and you will each have a toxin model. And these are live models, they're not mannequins, they're provided by us. You're supervised and obviously feel safe in that environment to practice out the procedure under guidance with the trainer to make sure you put into practice what you've learned. I would say for filler, it only gives you a taste of filler because you can't possibly learn everything in a day, but we do have some models for filler treatments as well. It won't be one each necessarily, but it will give you a taste of cheek filler, so lateral filler to the cheeks, or fill around the mouth, and we might use both needle and cannula, so different methods of delivering the filler product. As I said before, I didn't feel confident necessarily after my foundation day doing filler treatments on my own. For me, I did come back on an intermediate day, which is one of the courses included in our introductory package, where you review Botox and you get more practice with filler products, and that can be, I think, up to 3 delegates. You did something slightly different because I think you did a one-to-one.
I came and did a one-to-one. So I did my foundation day here again in Botox and filler. I think on the day we did a lateral cheek, like you say, but I definitely didn't feel confident to go and treat with the fillers afterwards. So I booked in with you and I came and did a one-to-one bespoke day where we covered cheek, nasolabial folds, some filler around the mouth. And I felt really confident afterwards and started treating from that week onwards. And then, but I just think that this is actually all about layers. So your foundation course is your first layer, and then you might decide to go and do your level 7, or you do a one-to-one, because we're always learning, aren't we? It's never a static kind of like career choice, if you like. And so I came and did another layer of treatment with yourself to help build my confidence.
And even now I think we want it to be seen as a medical specialty, and any other medical specialty you wouldn't expect just to do one day and that's it. So for your own building of skills and making things more interesting, you want to be learning new treatments. And also that means you're able to provide your patient with the best range of treatments and services. I think when I first did foundation, once I'd done the intermediate day, I then actually did courses here on chemical peels and microneedling because I was very interested in skin. So there often isn't one route, doesn't fit all. You can do either those skin treatment courses. We do courses in different skin boosters, the newer polynucleotides. It can seem quite overwhelming, but it all really needs to start with the foundation day, because that's your opportunity to see, is this something you're going to enjoy? Is this something that you will be good at? Because it's not just delivering the products, it's having an eye for assessment, what happens to the face in aging and where that can be corrected. So it's quite exciting. It's quite a busy day. There's a lot to do, but you also get well supported.
Absolutely. And also well supported from here, because we support our delegates from previous courses that we do, don't we? We always offer ongoing support.
Yes, so there's no time limit on that. I've even had queries from a delegate, I think we last saw, say, 5 years ago, and they can email in a question, or even I've had delegates phone up in a panic with a patient with a question or problem, and that's an ongoing process. We've got people here most days, certainly every day of the week, that can offer help and support as is needed. So I think that's a benefit for cosmetic courses, or that we can offer as well. Any other pros you think of talking about what the options after foundation day?
I think what you said was really important, is about, because patients now are very educated, aren't they, through themselves, and they will also always come looking for different modalities to treat different layers of the face, and like you say, on different signs of aging. So I think it is good to, yes, after your foundation course in Botox and filler, think about skin boosters or microneedling or other courses that can be add-ons, because our patients are seeking those treatments in the first place. So Fiona, if you've done your foundation course and then you decide to do your level 7, how would that work?
So you can certainly upgrade to the level 7. The foundation is included in the level 7, but if you don't want to commit to the time, or certainly the expense, before you've even done anything, I think it's quite a good idea to book the foundation day, see if this is something you're going to be interested in and like, and then you can upgrade to the level 7. So the cost of the foundation course will be deducted from the package. So that's definitely a really good way of getting into the level 7 course, I think. Well, one question, can I start treating after my foundation? What would you say?
I did my foundation course here many years ago, and so yes, you can. I guess what you need to do is start to build up confidence, and obviously it may not be that you decide to advertise yourself from day one or set up a clinic on day one, because it's probably is beneficial to come back and do some more training to consolidate those skills that you've learned. But actually, yes, you can treat from the first day afterwards, as long as you've got insurance. So obviously once you've got your certificate, then you can then go and seek some insurance, and then providing that you feel confident in doing so, then you can then start treating.
Because I would say when I first trained, which I think was with cosmetic courses in 2012, long time, I would have felt confident perhaps with toxin, but not with filler.
I agree,
And it wasn't until I had more training specifically with filler that I felt more comfortable to go out and try. And I think that will be different for different people. But it's quite a nice option to look at packages such as our introductory package, where you actually get 3 courses, which with a cost advantage of doing so. So again, you just get more experience the more you do, essentially. So how do I get my stock?
So again, once you've got your certificate and once you've got your insurance, then you then seek some reputable pharmacies, and there's quite a few out there. We have some connections with Health Exchange, for instance, and then if you're a prescriber, it's more obviously easy to access some Botox. You'd have a face-to-face with your patient that you want to treat, make sure that they're safe to treat, and then you would prescribe for them and then access these products from a reputable pharmacy.
So we still obviously get some nurses who aren't prescribers, so they have to find a prescriber. And we're always asked how they do that. Well, I would say if you know someone who's a prescriber, that's fine, but they do have to have a knowledge of aesthetics. It can't just be a friend who's a nurse prescriber or a GP or doctor in A&E. They do need to have a knowledge themselves. And sometimes we have people come on the foundation course to become prescribers. But there are also organisations such as Aesthetics Associates who help put you together with a local prescriber, because the other thing is they do need to see your patients face to face. They should not be online consultations. They have to see the patients. So there is a bit of logistics, isn't there, to making sure your consultations are on a day where you can get a few people together with the prescriber to see your patients at the same time.
Exactly.
And you pay a fee for that. And I think the average is still about £35.
£35.
So we then get nurses who have trained with us often who are interested in doing their prescribing course. Sometimes they can do that through their NHS role, but if they can't, more and more universities are allowing people to do the course based on the fact they want to practice aesthetics. And we will have people here where I've been the DMP or the medical assessor or supervisor for these people, and they come and do their hours with me here or with combined with perhaps yourself or one of our other trainers. So there are different options of getting your prescribing course, which if you're doing aesthetics, certainly more regularly, it makes it so much easier to do. Had you got your prescribing?
I had. I was already a prescriber.
So I guess that
so it was just like you say, it's just the logistics of it, always trying to make sure that that patient's able to come in maybe a few weeks before, make the prescription, and then come in for treatment.
This is a good next question. On completion, how do I get patients?
So obviously there's definitely different routes. So word of mouth, you might decide to start treating friends and family first of all to get your confidence up with that cohort of patients. And then after that, hopefully you'll find that ripple effect. So they will be pleased with their treatment, they'll look good, and people might say, oh, you know, what have you had done? And then you'll get that ripple. They might then introduce you to some more people and so on. Obviously, social media can either be your best friend or you might have a love-hate relationship with it, but it is a good way of getting patients, because otherwise who knows you're there, and it's just the best way of marketing, really. So I would say social media is quite important. Friends and family, word of mouth, and obviously advertising through Google and Meta are also other streams of being able to get patients.
I would say if you treat friends and family, and there's always a debate of should you be treating, that you should just do it correctly. Make sure they still sign consent forms, get them to pay for the product, even though they're not paying a fee directly, so that you're not in any way treating them differently, because they can still have complications, things can still go wrong. But I wouldn't say don't treat friends and family, because that's often your only source of starting out. I would find in the development of a clinic we have here, all my best patients have come from word of mouth, of just treating one person really well who's pleased, who only has to tell one other person, and they seek you out. So really, without having social media, which I appreciate is now important, you are your best advert.
100%,
and that also goes hand in hand with training. The better you are at something, the more conscientious, the range of treatments you offer is going to attract more people and make people more pleased with the results. I think there is still room for people who do this well, but a lot of people don't do this well, and that's where the bad name of the industry still comes
and
in.
I think that actually leads on to it, because when we do our foundation here, we actually cover the consultation, don't we? We talk about business setup. So we do hopefully give people a lot of skills to be able to go out there and find their patients as well, don't we?
Which is often skills we don't have. If you've been working in the NHS as a team, particularly in the hospital, you haven't necessarily had to think about business. You've not worked on your own. You've not had to take payment from people directly. So there is a whole new skill set you have to learn, and it can be quite daunting sometimes. So I think it's fair to say there's different routes for different people, whether that's the level 7 or investing your money on more practical courses is something you have to decide for yourself. I would say if you've got any further questions, you can email us on ask@cosmeticcourses.co.uk, and one of our delegate coordinators or one of us as a trainer could reply to you or speak to you on the phone if necessary, so that we can help you on your aesthetic journey.
So as a special thank you for joining this webinar today, we're actually going to get each and every one of you 10% off all of our courses at Cosmetic Courses. So that includes the level 7 and the foundation course, but just not our bespoke one-to-one course.